New South Wales Health this year receives $884 million extra in terms of recurrent funding. That's a growth of 5.2%. It's a record recurrent budget of $17.9 billion. And as well as that, we have $1.2 billion, which is our next tranche of the $4.7 billion investment in hospital infrastructure. So the total health budget this year, over $19 billion. Of the recurrent budget, $220 million has been allocated for increased activity, including 69,000 extra emergency department attendances, 34,000 extra overnight admissions, 3,000 extra elective surgeries. And I'm very excited about the $30 million we've invested for integrated care partnerships to deliver better care in the community. Now, local health districts can choose to use some of their growth funds for this purpose and attract matching funds from this pool. On top of the $884 million in new recurrent funding, New South Wales Health will receive $186 million in efficiency savings for frontline services. Now, this is important to understand. In every other agency, those efficiency savings have to be handed back to Treasury. Not so in health. We get to keep those savings to convert them into new frontline services. I'm very excited about what's happened this last financial year. We've seen some wonderful work by our people out in the local health districts. For example, $7.7 million saved on the Central Coast by reducing the average length of stay. Across the state, $15.7 million using the Chronic Diseases Management Program has avoided unnecessary hospitalisation. And the Blood Watch program has saved over $5 million across the state, leading to more appropriate use of blood products. As well as that, I'm very proud to be the state's first Minister for Medical Research. And we have a record budget for medical research this year, which includes $38 million for the Medical Research Support Program and additional funds for our Medical Devices Seeding Program, which you'll see more information about in the coming days, where we're funding those devices to get them to closer to commercialisation. In addition to that, we have increased funding for cancer research. So all told, it's good news for New South Wales Health. In a very tight fiscal environment, I believe we've done well to have 5.2% growth in our budget, and also to be able to keep these efficiency savings, which will convert into much better frontline services.